Hi everyone, my name is Carrie Smith. I'm a board certified sexual assault nurse examiner in both adolescents and pediatrics. I'm the SANE coordinator for WVU Medicine, Berkeley Medical Center, and Jefferson Medical Center. So I'm excited to offer this presentation today so that the community is aware of the resources we have here at our hospitals. So let's start with the stats for sexual assault. So in West Virginia, 1 in 6 females will be a victim of an attempted or a forced rape in their lifetime, and 1 in 21 males. Out of those victims, only generally 16 to 30% actually report that crime and come in and get care. So we're seeing a small window of patients in that area. And so just imagine if that patient presented to a hospital and there was no SANE to do a sexual assault exam. They would have to be referred to another facility and travel sometimes hours to get to a specialist to do that kind of care. I'm really proud of the fact that we have this program here and we do not have to transfer any of our patients out of our area. When I say we cover Jefferson and Berkeley Medical Center, our nurses respond to both hospitals. So if a patient presents to Jefferson Medical, we don't transfer you to Berkeley Medical. We do the care at Jefferson Medical Center. Let's go here. So this is our program here at Jefferson and Berkeley Medical. It's called, we like to say we're the forensic nurses, we'll be there for you, kind of playing off the themes theme a little bit. We Believe You is one of our big campaigns that we do every year. We understand how trauma affects your brain, and we understand that sometimes people present differently after a traumatic event. They may be laughing, they may be scared, they may be angry, and it goes into that whole patient-centered trauma-informed approach that we like to bring to the services. SANE nurses in particular, they've gone above and beyond just being a registered nurse in their specialized care. It's a unique population that we serve, and we've all been trained in that patient-centered trauma-informed care. So let's talk about some of the services that we offer in the Eastern Panhandle. We offer acute, adult, and adolescent exams. That is for 96 hours post-sexual assault. We do strangulation assessments for any victims of a strangulation. We offer lots of pediatric services, and we touch on human trafficking as well. Throughout this presentation, I'm going to go through each 4 of these and talk a little bit more about how we care for the victims when they do present to the hospital. So a lot of people ask me, what is a SANE nurse? Well, it's basically a registered nurse who has received specialized education in the provision of trauma-informed care, complex patient assessment, identifying risks, and providing prevention for short and long-term physical and psychological support, reproductive and sexual health care and treatment, forensic documentation, evidence collection, and expert witness testimony. Now that's a really long definition, and we're going to start to break that down a little bit as to what we actually do. So our primary concern when you present to the hospital is safety. Throughout the whole exam, we want to make sure that you know that you're safe and that we're going to keep you safe, and that when we discharge you, you're going home to a safe environment. Our next process is your medical concerns. We want to make sure we take care of any medical concerns that you may have before we even start the examination. And then our third primary concern is evidence collection. That comes at the end. That's where we collect the evidence to send that off to the state crime labs. So the goal of our exam is to provide that immediate, compassionate, culturally sensitive, and comprehensive forensic evaluation and treatment. We want to be able to give back the control that you lost during the assault. That again goes back to that patient-centered, trauma-informed care. So I like for people to know that in West Virginia, you do have options when you present for a sexual assault. You can decide to involve law enforcement with a report, or you can decide that you do not want to involve law enforcement. That would be a non-report exam. And what does that look like? So for a report, we do all of the examination, we do everything, and we hand over our paperwork to law enforcement. I myself or one of the other forensic nurses will ship the evidence directly to the West Virginia State Crime Lab. If it's a non-report, law enforcement's not involved at all. We put all of the paperwork in with the evidence, and we send those kits to Marshall University. There's a holding facility out in Marshall that holds all of the sexual assault kits for non-reports. And then if you decide to, later in life, prosecute or press charges against the assailant. You have all of your evidence collected. You just you had to take time to process that and decide if you wanted to do that option. So one of the things about this is, remember, anyone under the age of 18, though, we are mandated reporters, and those cases we have to report to law enforcement. It's the law, and we have to call CPS on those. So essentially, anyone over the age of 18 in West Virginia gets to decide if they want to involve law enforcement or not. Regardless if you want to involve law enforcement, you still get the same exact care from the forensic nurse team that you would if you did involve law enforcement. So we're going to talk about acute versus non-acute exams. So with the acute exam, that is within the 96-hour window, and we will do all of the evidence collection. If it does not fit within that 96-hour window, we will still do an exam for you. We will still offer you, for instance, the STI prophylaxis. But let's talk about special circumstances. So that 96 hours is not a hard stop. We don't automatically say a definite no. For instance, if someone is homeless and they have not changed their clothes, we would still do evidence collection on that patient. If they were assaulted and then held captive for a week, obviously they haven't changed their clothes, they haven't bathed, we will still do evidence collection on those. So it's important to understand that that 96 hours is what West Virginia says for evidence collection, but it's not a hard stop. As a matter of fact, other states actually go up to 120 hours. So we still can get some evidence after that 96 hours in those special circumstances. So the biggest part of our exam, it's the first thing we do, is we want to get your consent. We want to make sure that you are fully informed on what the exam entails. And then throughout the exam, I want to make sure that it's my responsibility to maintain assent. So if I feel that you are uncomfortable with anything that I'm doing to the exam, we stop. We don't go forward. Remember, this is very patient-centered. I want to give you the control back. You are in control of everything. You get to control how the exam takes place. So here's a good situation. If someone comes in after a sexual assault and we are consenting them to the exam and they decide they want evidence collection, but maybe they don't want photography, that's okay. We're not going to do photography. We're still going to do everything else. That doesn't mean we stop the exam and we give up. We do everything that you would like for us to do. We don't do the things that you don't want us to do. Same type of care. So let's talk about an overview of a SANE exam. What does that really look like? I have this nice little picture down here in the bottom. That's our Cortex flow camera system at the hospital. We have one of these systems at each facility, and that just gets those forensic photography pictures that we want to see. So the first part of the exam, like I said earlier, was the consent. The next part is the medical history. I want to know about any chronic illnesses you may have, any allergies, any recent injuries that you may have that are not related to the assault. Those all make sense when I'm doing my evidence collection. Also in the medical history, I would like to know any medications that you're on and how those medications affect you. Next, we're going to go into the account of the assault, and that is basically just you telling me what happened during the assault. We write it word for word. I don't make up anything. I don't paraphrase. I write it exactly like you tell me. Then we go into the head-to-toe exam. Now, the head-to-toe exam is based off of my medical history and my account of the assault. It's directly guided through that. So I'm looking for any kind of injuries that you may have sustained, any kind of tenderness that you described to me, any deformities, anything that is out of the ordinary that happened from the assault during my head-to-toe exam. And then while I'm doing that head-to-toe exam, I'm getting evidence. So that's the part of evidence collection. We're swabbing certain areas that may be high potential for a DNA yield. For instance, if you tell me that he kissed your neck during the assault or he bit you during the assault, and he did it on your neck per se, I'm going to be swabbing your neck for evidence. That again is based on what you tell me during the assault and what I find during the head-to-toe assessment. The next part is the photography. This is a very sensitive area. We understand that. We're going to be getting photographs of all of your injuries on your body, but it also includes that genitalia area if we see any injuries. A lot of people do not want pictures of their genitalia. We respect that. I would not do pictures if you did not want that to be done. But when it goes to prosecution, any pictures that we take can be brought up in court and they go a long way in proving your case. And then here we come to the beginning. I'm going to be testifying for the prosecution. So all of our forensic nurses are expert witnesses in Jefferson, Berkeley, and Morgan County, and we do go to court with you at the end, and we will testify on your behalf from the exam. So we're going to talk a little bit about medications. What medications can you get after a sexual assault, even if you are out of that evidence window collection of 96 hours? So on all of our patients, we do offer the STI prophylaxis. That's for your gonorrhea, chlamydia, trichomonas, BV, all of those types of things. We don't necessarily test you for STIs. We treat across the spectrum. So we just assume that you may have gotten something, and we go ahead and treat you with the medications here so that you get those in your system. We provide emergency contraception. Now, I know emergency contraception is a sensitive subject around the abortion policies. So with Plan B and Ella, they are not the abortion pill. It is simply a pill that blocks the ovulation process. So if you were already pregnant, the emergency contraception is going to do you no good. It's not going to even abort the baby. We do a pregnancy test before we prescribe either Ella or Plan B. And if you were already pregnant, it's very, very unlikely that you're pregnant from the sexual assault. So we would not give you these types of medications. But I want everyone to understand that emergency contraception is not an abortion pill. We're not aborting a pregnancy. It's just preventing the egg from ovulating. And then we talk about vaccinations. This is a good one because some victims only come to the hospital when they've been a victim of a crime. And we understand that. So we can, while you're here, let's get you the vaccinations, get you caught up in your vaccinations that you may need, do any type of medical care that you may need while you're already in our facility. And then the last one is MPEP for HIV prophylaxis. So the risk of getting HIV after a sexual assault is very, very, very slim. But it's still a risk nonetheless, and we need to treat that as a risk. So we can offer you the MPEP medications, which is a 28-day medication regimen. You have to start it within the first 72 hours post-sexual assault, and you need to take it for the entire course of the 28 days. Now, MPEP medication is very, very expensive. It can be into the thousands of dollars. But we have affiliations with certain programs that can get you those medications for free. So I don't want anyone to not take it because they feel like they can't afford it. We can get those bills paid for you. We can get it free of charge and overnight it to you. After the sexual assault exam portion, we do discharge planning with you. And what does that look like? First, we're going to offer you resources. So with every sexual assault, we do bring in outside advocacy agencies, for instance, the Eastern Panhandle Empowerment Centers, who we use in our area. They will come in, they sit with the patient during the exam, they provide them the support that they need, and then after they leave the medical facility, they continue to do advocacy services outside of the hospital, whether that's filing for protective orders or helping to get tracking their kit, making contact with law enforcement if they wanted to. I always like to say that when you're in the hospital, I can provide you all of the resources that I can in the hospital, but once you leave, it's kind of out of my hands. And that's where the Empowerment Center picks up and they provide their advocacy services. We also do safety planning. Some people go back to their homes where the perpetrator is, and that's okay, we respect that. But I want to talk with you a little bit about what that looks like when you go home. Are you safe? Do you have a safety plan in place? So when you maybe one day in the future you do want to leave that situation, and what can you do to help with that? I also don't want anyone going back to a situation where they don't feel safe and the perpetrator is there and they don't want them to be there. So we do planning with them as far as whether or not we need to involve law enforcement. The Empowerment Center goes back and reconnect with them. So we want to make sure, like I said in the very beginning of the presentation, your safety is our number one goal. We do recommended studies with the physicians. For instance, if you told me during the examination that you had a strangulation episode, I would recommend to the physician to do a CTA of the neck. If there are injuries that I feel the physician needs to address afterwards, I will explain to him those injuries and let him or her address those as they feel needed. Follow-up exams. So in our facilities, we refer our patients to their primary care physician for 2 weeks after follow-up. But we also cover behavioral health services. You may need a consult with a gynecologist. All kinds of those, we can refer you to those specialists. And then lastly, we give you a discharge information folder. In this folder, we provide you with everything we did during the exam. If you report it to law enforcement, we'll let you know the law enforcement agency that we reported it to. We have your kit tracking number in there. We give you information on what it looks like to be a survivor of sexual assault and the things to expect in the next coming days. We also have the Empowerment Center's information on there for them. And then the kit tracking sticker. So this is something West Virginia has come up with to track evidence kits for sexual assault. Once you leave the examination, you can log on to their website and put your specific kit tracking number in there, and you can watch it go through the whole process as to when I mail it from the facility and it gets to the state crime lab, when they've actually opened an investigation on it, if they do, and then what are the results of that investigation. So that's a really great thing that West Virginia has developed with the kit tracking system. So we've talked a lot about sexual assault, but I do want to touch a little bit on strangulation because we do those assessments here. Number one, strangulation is a felony in West Virginia. The definition of strangulation is any pressure applied to your external, to the neck, that impedes either cardiac blood flow or airflow and results in asphyxia. And then let's talk about your stroke risk. So anyone under the age of 45, women, it's the #1 cause of stroke for women under the age of 45. It's a serious risk. And your risk of stroke starts after the strangulation and it can go to years after the strangulation. So sometimes I see victims that have been strangled 6 months ago and they feel that everything is fine, they never saw any injuries. I still want to get those patients in to see a physician to get the recommended studies for that. While we're talking about signs for strangulation, only 40% of strangulation victims actually have injuries that you can see. And out of those injuries, only 15% we can actually pick up with a camera. So just because there are no injuries does not mean it was considered strangulation, or it doesn't mean that it was a serious strangulation. It can happen, you can go unconscious in 5 to 10 seconds from a strangulation. It takes 1 to 2 minutes to die from a strangulation. That's how serious it is. And then the medical care for the strangulation. We want to get those CTAs of the neck to look for those carotid artery dissections. And then make sure, again, we'll go back into that safety planning with you and the resources that we can offer you from the Empowerment Center for Outside Resources. Another big part of our program is the pediatric population. So when I talked earlier about evidence collection, that window of 96 hours, that's for the adults and adolescents. We also do at Jefferson Medical Center non-acute pediatric exams. We know that most pediatric patients don't report a sexual assault. It takes months, even years to report that. So we will bring them in and do a non-acute exam on them to check for any abnormalities and basically just to reassure the kid that everything looks okay and that your body is normal. We handle abuse and neglect of pediatrics, so we can take pictures with our Cortex Flow camera that you saw earlier. We can recommend assessments to the physicians. Another part of our pediatrics is the mandated reporting. So as a healthcare provider, we are mandated to report any suspicion of abuse and neglect or sexual assault to anyone under the age of 18. We have to do that. That's our job. There's no way around it. And we just report on suspicion. Just because we make a report doesn't mean that something's going to happen or the police are going to come in and take custody. We're just reporting on a suspicion. It's out of our hands at that point, and that's where law enforcement and CPS take over and they do the investigating. So again, sexual assault for pediatrics, abuse and neglect. And the last part I want to touch on today is human trafficking. I know we all want to turn a blind eye to this and we don't think it happens here in the Eastern Panhandle, but actually in the whole state of West Virginia, we have the most human trafficking cases of anyone. Most of our human trafficking cases are familiar, where that means the parents are trafficking their own children out. We have a huge drug population in our area. We can't turn a blind eye to that either. And our trafficking is about 50-50. It's, half of it's labor trafficking, half of it's sexual trafficking. So how can I help as a healthcare provider? Well, if you look at the statistics, 87% of human trafficking survivors have stated that they came in contact with a healthcare provider at some point of their trafficking career. Okay, 87%. Out of that 87%, only 3% were actually reported from a healthcare provider. So what does that tell us? That just tells us that as healthcare providers, we are lacking in a lot of the knowledge to pick up on these human trafficking red flags. So at Berkeley Medical Center and Jefferson Medical Center, we have a big pitch right now with training our healthcare facilities on these red flags and offering the resources we can to these victims. So speaking of resources, what do? Well, we can offer you help. We can call the Polaris National Human Trafficking Hotline and report any tips. We can bring the Empowerment Center in to offer, again, those outside advocacy services. And then we can talk to you in that patient-centered, trauma-informed manner. It's the forensic nurses that are sitting down with you and spending 2 and 3 hours to talk with you and figure out a plan. If you decide that you don't want to leave your trafficking situation and you're over the age of 18, that's your choice. But we can offer you some resources. We can start to plant the seed that this isn't a healthy situation for you. And maybe the next time you come, you will be getting out of that situation. And while we have these victims in the hospital, why not give them the best kind of care that we can give them while we have them for that small window? What does that mean? Vaccinations, preventative care. Maybe it's a vision screening. Maybe it's just some lab work. So where in West Virginia can you get an exam like I've talked about today? Actually, in West Virginia, there's only 2 places. Ruby Memorial out in Morgantown, and then Jefferson and Berkeley Medical Center. We are the only ones that offer the 24/7 access to a sexual assault nurse examiner. And like I talked about earlier, our program covers both hospitals, Jefferson and Berkeley, and we respond to the hospital where the patient presents. Oftentimes, after a sexual assault, we are the first place that a victim comes to seek services. And then we can offer those resources, whether it's calling law enforcement, involving them, involving advocacy agencies, involving prosecution, involving CPS, whatever it needs to be, but they often present to us first. So this is just a little picture of what our sexual assault exam room looks like at Jefferson Medical Center. As you can see, it's very warm and comfortable. It's not in the main ER, so it's out of all those bells and whistles. A sexual assault exam usually takes about 3 to 5 hours. So we are in this room together for 3 to 5 hours just talking and making sure we are meeting all of your needs. We want to make sure that you get the best care possible. The main goal of our program is to make sure that you leave in a better place than you presented. We want you healthier when you leave. And what better place to do that than Jefferson or Berkeley Medical Center? Thank you.